Chair, Conference. Johanna Baxter, very proud to be one of your voices on our National Executive Committee. Conference, we have heard much this week about the financial crisis and the government's credibility deficit. But in no other policy area have they demonstrated greater dishonesty than in respect to our National Health Service. Conference, before the last election, David Cameron said, "I'll stop top-down reorganisations of the NHS." Since the last election, David Cameron has presided over the biggest, most reckless top-down reorganisation our NHS has seen in its lifetime. Before the last election, David Cameron said, "I'll cut the deficit, not the NHS." Since the last election, we learned that staff are being sacked by strategic health authorities and PCTs, taxpayers facing an estimated £852 million worth of a bill for redundancies as a result of this reckless reorganisation. And he can't even confirm that those individuals who are being made redundant won't be re-employed by the new clinical commissioning consortia. Before the last election, David Cameron said he would have a bonfire of the quangos. Conference, the only thing that's gone up in ashes are his promises. Since the last election, we learnt that his reckless reorganisation will involve spending £80 billion creating the NHS Commissioning Board, the largest quango the world has ever seen. Even Sir David Nicholson, who will chair it, has already warned that the NHS Commissioning Board will become the greatest quango in the sky. Conference, before the last election, we said we would protect the NHS. It is our greatest achievement. There is only one party of the NHS. We know it's not the Tories. It's this party, Conference. It's the Labour Party that is the party of the NHS. And since the last election, comrades, we have opposed the Health and Social Care Bill at every stage. Just because the papers choose to focus on the dividing lines between the coalition partners, don't be mistaken about the efforts which are being made to fulfil our promise to you. It was only because of our coordinated action that Cameron's Tory-led government was forced to stop, take stock and listen to the people of Britain. Well, David Cameron may have said he would listen, but he certainly did not act. The bill still fragments the NHS and turns it into a regulated market, which puts competition ahead of patient care. Monitor remains an economic regulator responsible for enforcing competition law. Hospitals will still be able to prioritise private patients over NHS patients. And it still removes the principle that the Secretary of State for Health is accountable for the delivery of the NHS. Conference, at a time when the NHS should be focused on meeting an unprecedented financial challenge and delivering world-class patient care, this new NHS under Cameron will be more bureaucratic, it will have greater complexity and it will cost more. We are already seeing the effects of Cameron's incompetence. In July alone, nearly 30,000 patients waited longer than 18 weeks for their treatment. It's very clear that this reckless reorganisation will undermine all of the progress that Labour made to deliver the shortest waiting times and better access to treatment. Cameron will fail people like Philip Gould, who recently in his death zone said that the only regret he had about his treatment was that he did not go to the NHS sooner. David Cameron still pretends that everyone's behind him. We're all in it together. Conference, we need to make sure that he knows this is not true. We all have a memory of why we love our NHS, be it the care for an elderly relative, a disabled relative, or even our own personal experiences. Conference, I would ask you this. Remember that reason why you love our NHS. Go out into your communities, tell them that's why you want to save our NHS. And if you've got a smartphone on you, do it now. Facebook it using hashtag #SaveOurNHS. I move the report. Thank you.
All right, thank you, Johanna. We're now going to take the movers and seconders of Contemporary Composite 5, which is on health and social care. So that's GMB to move and Erewash to second. And I would appeal, if possible, to be concise.